How are y'all tonight? Good? Excited? Yeah, so we're super excited. So I'm Emily. I'm one of the dietitians here and the program manager. There's a couple of other support staff over here. So Jenny, our dietitian, Catherine, one of our dietitians, and then Brandon, our social worker. So if you guys have questions for us at the end, we're happy to help you with any questions. We're going to turn this over to Dr. Keandra Scott. We're super excited to have her here. She is a plastic surgeon here, and we're super excited about that. So she's been here since August and already seen a lot of our patients, and we hope she sees a lot more. So I'm going to turn it over to her and let her go through her presentation, and then as you guys have questions, I'll stand over there. As you all have questions, we can wait till the end kind of and go over those things, okay? Okay.
Hi guys.
Hi.
Thanks for having me. As Emily said, I am Dr. Keandra Scott. I started here in August and did my training in Charleston at the Medical University of South Carolina. And we did a lot of these surgeries. We also had a bariatric program there, so we saw a lot of patients who lost a ton of weight and needed skin to be removed. So that's what we're going to talk about today. I don't have any disclosures. So, as I said, we'll talk about what is massive weight loss or weight loss, what procedures are available, insurance requirements, so we'll go over some examples of that, what is required of you guys should you undergo the surgery or lose weight on your own, and some self-pay costs. So there's a couple of different ways to lose weight, or two categories, I should say, surgery and then non-surgical options. I think most of you are here because you're considering surgery. So there's different options. You can have a sleeve gastrectomy, a gastric bypass, gastric banding, or what they call the Cadillac of gastric surgery or bypass surgery, which is a biliopancreatic diversion with or without a duodenal switch. And then there are some non-surgical options here. You can use medications, which if you're gonna do that, still eat healthy and exercise. And here at LEC, we do have a bariatric medicine specialist, Dr. Lee. So I refer a lot of my patients to him who don't want to undergo surgery. So what is massive weight loss? That essentially means losing 40% or more of your excess weight, or when you lose 100 pounds or more. And excess weight is technically the percentage of weight over your ideal body weight, which those equations are over here. It's a little bit different for men than women, but the ideal body weight is not perfect. So a lot of nutritionists and dietitians may refer to the adjusted body weight for that. As I said, the ideal body weight is not perfect. It does not consider the amount of natural fat or muscle a person has. So then we use the adjusted body weight, which is essentially your ideal body weight plus 0.4 factor times the difference of your actual weight from your ideal body weight. You don't need to know that unless you're like a math nerd. But I thought it was cool to put it in here. I do have an example. So let's say a man weighs 264 pounds, he's 5'5". He then converted to kilograms, weighs 120 kilograms. His ideal body weight is 135 pounds. That seems really steep from 264 and kind of unrealistic. So calculating his adjusted body weight, which that would be 187 pounds. So in excess, he is 41% over his adjusted body weight, not ideal. So if he reaches that 187 pounds, he's considered a massive weight loss patient. So you can apply that to yourselves or someone you know for once you get surgery. So why does this matter to me as a plastic surgeon? So excess weight causes a lot of issues, as you know. But even once you lose the weight, which is good, you have a lot of issues with your excess skin. So it's not just cosmetic, why some of you may come to see me or another plastic surgeon. The excess weight causes rashes. That area may be difficult to clean. Back pain, neck pain, depending on what area of your body you have excess skin. Your clothing may not fit properly. You may have body image issues. And all of these things lead to a decrease in quality of life. And we know that research has shown and proven all of these things. Body Q is a questionnaire that some surgeons use to assess a patient's image of themselves before and after they have body contouring procedures. And some of the things that the questionnaire focuses on is your appearance of your different body parts, your eating habits, and any quality of life issues, and then the experience of your care. So that's something that you look up and kind of assess yourselves. So what is body contouring? We'll go over different procedures, both in the insurance-based column here and then cosmetic. If you see this symbol, which is the American Society of Plastic Surgeons, that's good. It's a reputable website. That is our national society that accreditates any plastic surgeon. Okay, so not necessarily a cosmetic surgeon, but someone who's trained in plastic surgery. So that's really important. You know, a lot of patients go to Miami or out of the country, and they're not really seeing someone who's trained in plastic surgery. So I won't really talk about these procedures, but you can have facial excess skin. So when you lose weight, even though you're young, your face can droop, your skin and around your chin, your face, your eyes, all of those things can droop after you lose a lot of weight. So these are some options of surgeries to help lift that skin. Facelift, neck lift, brow lift, a blepharoplasty, which is removal of your upper eyelid or lower eyelid skin, and then any laser treatments to help contract any loose skin. So why do patients seek contouring procedures? So the right reasons are to get rid of the skin, to help treat your rashes, to help improve the shape of your body or face, and to allow your clothing to fit properly. Wrong reasons are to lose weight. I see a lot of patients who come to me and they want belly tissue removed, but they think it's going to help them lose a significant amount of weight. It is not. It's simply to remove skin and fat, okay, after you've lost weight. I put in the column wrong reasons to fix insecurities or self-esteem because sometimes you need a mental health provider to fix those things. Yes, if you were to remove the skin that's causing you, to have some low self-esteem, it may help, but that's not the sole reason you should come and see me. Does that make sense? So we'll start by talking about the trunk, which is your abdomen and your back. Any questions about anything I've said so far? Good. So panniculectomy, it's a long word, it's difficult to pronounce, but essentially it's removing the pannus or skin below the belly button. Okay, so who can undergo a panniculectomy? Anybody with excess weight of the lower abdomen. Usually insurance companies like to see that tissue hangs below your pubic area. That's how they figure out who they want to approve the surgery for or not, or one of the ways. And anyone with back pain, so lower back pain, the rashes, stress, and then your clothing not fitting properly. This is what I've listed here is not necessarily what insurance wants to see, but what I think is important for patients to undergo the surgery. Also, you have to be in good health. So controlled diabetes, controlled high blood pressure, not a smoker, which you'll see pretty much all of those things for any of the procedures we'll talk about. Okay, if you have heart disease, that has to be optimized. Kidney disease, usually try not to operate on anyone with severe kidney disease, but you just have to be in good health. So when can you undergo a panniculectomy? Usually, so anything I'm going to talk about today is in relation to weight loss surgery, not just anyone who's not undergoing weight loss surgery, okay? So 18 months after you've had your surgery, and then 6 months in that time or after, your weight has to have been stable. So you can't still be losing weight during that time. And then I have a video to show how it's done, but where you can have it done, any plastic surgeon but Lexington Medical Center. So how do I?
You want me to?
Yes, the first video, I think. It's okay.
Hold on, let me try to pull it from you.
Yeah, you probably have. Sorry.
It's my fault. It's my fault. I put up all the videos, but didn't try them on the screen.
I'll just talk about it. So, essentially, paniculectomy, as I said, is removing the tissue from below your belly button. That's it. It does not involve liposuction. It does not involve tightening your muscles in the middle like a tummy tuck. All it is just removing that skin and tissue. So, from an insurance standpoint and from my standpoint, it's functional. It's not a cosmetic procedure. If you were to get denied by insurance and you would like to pay out of pocket, it's still the same thing because the cost is different from a tummy tuck, and we'll talk about that as well. Oh, I didn't try. Sorry. So insurance. So this is from I think Blue, South Carolina Blue. I just took a picture of it and put it here. I know the words are very small, but here it says medically necessary, here it says not medically necessary. So medically necessary means that insurance would likely approve it. And if you go to your insurance plan and you look up your plan, just because they have that it's medically necessary doesn't mean that they will approve it. So we've seen that too. So number two, one of the following, you have to have, number one, your penis hangs below the level of the pubis, which I talked about. I send photographs, so they want pictures. And you have to have recurrent rashes or infections or ulcers in that area under the penis. And you have had to try topical or oral antibiotics or antifungals or whatever for 3 months and document that it did not work. Okay, so you can't just like have surgery and then meet the timeline requirements and say, hey, I have extra skin, I want to have it removed. Insurance will likely not approve it if you don't have these things documented, even if you have skin, like low skin, okay? Or you have issues with walking, so your penis is so large that like you can't get around, you can't exercise, that kind of thing. And you have functional impairment that persists even after you have lost weight. And they want that documented as well. And then here, they just reiterate the 18 months after surgery, so you have to wait that, and a stable weight of at least 3 months. So this particular plan, it's 3 months of stable weight, okay? Does that make sense? And again, what's not medically necessary? Paniculectomy is not medically necessary when you don't meet these criteria. And it's not medically necessary when it's used in conjunction with another procedure such as like a hysterectomy or a hernia, okay? But it's definitely not medically necessary with an abdominoplasty or repairing those muscles like we talked about, okay? So a lot of patients will come in and say, my insurance approves an abdominoplasty, which is a tummy tuck. It doesn't. Some of them list it next to a paniculectomy, but they will not cover it, okay? And liposuction. They don't approve that for anything, except breast cancer. Any questions about that so far? Oh, yay. surgery. So here, he's just showing what the patient looks like. That skin marking is the skin that's going to be removed. So he's going down, and if anyone like doesn't want to see this, just let me know. Okay? But this is what it looks like, okay? Just removing the skin, the fat. We're not going inside the belly, just everything on top of your, what we call abdominal wall. So that skin marking you saw is below the belly button. He did not move the belly button at all, just removes the skin below the belly button, okay? In some cases for a peniculectomy, I do move the belly button just because I don't want you to have skin like hanging. It just looks better. Okay, so these are some photos. So this is a lady who, she lost some weight, but not like a lot. But she qualified for a peniculectomy. This is her pubic area. You can see she has multiple rolls. This one really just large. She was not comfortable with that, did not like how she looked in clothing. So this is what she looks like. I did have to move her belly button just because this was so thick, it was, you couldn't move it a lot, if that makes sense. And she's 4 months after surgery. She was not interested in losing any more weight, but her BMI was around 32, so she met qualifications for me to do her surgery. And she's very happy. Her stomach is flatter. She doesn't have those rolls anymore. Her scar is straight. You can see this is really dark. So that's her. This is a man. He underwent a gastric sleeve, lost over 100 pounds. He too, and I offer most patients all the things for body contouring. I don't just say, oh, you qualify for a peniculectomy. I offer a tummy tuck. You know, I send quotes, body lifts and all that. But he wanted to just go with the peniculectomy, so we just did that, removed the skin below his belly button. You can't really see the scar up here, but he had a scar around here. That scar is now here. So he had a lot of skin laxity that the picture is not showing. Had he, you know, wanted liposuction and all of that, these little saddlebags would have gone away, but that's what he looks like a month and a half after surgery. Plus he's still swollen, so that's that. Yeah. Any questions about that surgery?
You said you always remove the belly button?
I most of the time do, so we don't remove the belly button. We just cut around it, pull the skin down, and then make a new hole and pull it out.
Okay.
Okay? And the same thing for a nipple when I talk about breast reduction. So what are the risks of the surgery? Wound healing issues. Anytime we do any plastic surgery, there's a lot of incisions. Any point along that scar, it can open up a little bit. It's not usually an issue, it just heals in on its own. And the reason that happens is from a lot of tension, so you're pulling the skin, trying to make the patient flat, okay? Usually it just heals in with some antibiotic cream. And this happens more in massive weight loss, gastric bypass patients, just from the nutrients. Maybe they don't have a lot of protein, aren't eating a lot of protein, but sometimes your belly button skin doesn't have a lot of blood supply, and it can either have some wound issues or you could lose it completely. I haven't had this happen to me, but I've seen patients that has happened to, and they want a new belly button. Infection, which could be a small skin infection or a large abscess. It's rare. Usually it's if you're still obese or poorly controlled diabetes or something like that. Bleeding, that can happen, again, small or inside, which is called a hematoma. Usually this will happen the day of or the next day. You don't really have to worry about that after that. Fluid buildup or a seroma, that happens anytime you create a space in the body with surgery, any surgery. Your body wants to put something there, so it'll build fluid up. And usually that happens after your drain tubes are removed in a couple of weeks. And again, You want to be healthy, not still obese, not smoking, adequate protein levels to prevent or lower the chances of you having any of these complications. So moving on to abdominoplasty, a standard abdominoplasty is same thing, removing that skin and tissue from below the belly button, and we absolutely go above the belly button because we do want to remove as much skin as possible. We do repair the ab muscles, so that's called a plication, rectus abdominis plication, where you're cinching in the waist, so it gives women that nice kind of curvaceous waist. And sometimes when you have kids, those muscles separate. And if you're really obese, your obesity behind your abdominal wall is pushing your muscles apart. So we have to repair that to give you a better shape. Again, same qualifications on when to have this surgery done if you're a massive weight loss patient. And he's just numbing up his patient, but he's going to remove a lot of skin and tissue here. He's also doing liposuction, so anytime I offer someone a tummy tuck, I do liposuction. It just gives you better contour. I do offer it if I'm doing a paniculectomy as well, just to give you a better shape. So I'll say, we'll submit the paniculectomy to insurance, and then I'll send you a quote for liposuction.
So is this the skin pulled back and then
Yep.
they're doing the sutures from?
Yep, so the skin's raised up, okay, and then those sutures there, he was repairing the abdominal muscles, like
Okay.
we talked about. And men, we do that too, okay, it gives you a better shape.
And is this after a bariatric surgery and weight loss or? is
Yes,
it-
this patient did have weight loss. She still had a very full belly, which I'll talk about that too. And you'll see at the end, she still has some fullness to her belly, but the bottom part's improved. The shape looks a little bit better. Yeah. So I just tell patients, get to your weight goal, or even lower, because you'll have a better result. Okay.
How long are you in the hospital for?
So paniculectomy, abdominoplasty, most of these we go home the same day.
After all that?
Trust me,
Is that
it's
your
not.
choice?
It is.
Is that your choice?
Insurance usually will pay maybe for one night, but if you're paying out of pocket, you're not going to want to pay to stay in the hospital. Trust me. And the only thing that takes a long time is the closure, because you want it to look nice. But taking the skin off takes like 20 minutes. Okay, it looks like a lot. Like I said, if this bothers anyone, I can just talk about the surgeries. We don't have to show them.
What does time out of work look like for students?
What's that?
What does time out of work look like?
So usually 6 months, or 6 weeks, sorry.
Are you paying that?
6 weeks of recovery, but for an abdominoplasty, absolutely 6 weeks. For a paniculectomy, 2 to 3 weeks out of work, depending on what you do for work. If you have a strenuous job, I would say 4 weeks automatic for most of these surgeries, where you're lifting heavy things, that sort of stuff. Okay. So we kind of talked about this. This picture just kind of shows the difference between a paniculectomy, which just removing the skin here and pulling down, and an abdominoplasty, you're repairing those ab muscles there. Yes. Any of these surgeries, again, have to be healthy, not smoking, and good protein levels, but if you have like rheumatoid arthritis, lupus, or you're like chemotherapy or some kind of drug that will cause your immune system to be lowered, we usually don't offer these surgeries to you because your chances of having an infection or wounds not healing are very, very, very high. Okay, with an abdominoplasty specifically, if you have a high risk of blood clotting, or you or your family, because we're pulling those abdominal muscles tight, it presses on the main vein in your body, and that can cause you to have a blood clot just from this surgery alone. So if you already have risk factors for that, usually we'll say, maybe this is not a good idea. A good surgeon. So fees. So these are not my fees. I don't really discuss costs, but the average across the country is about $9,000, with a range of 5 to 18, with the caveat that if you see someone having a special for like a $5,000 tummy tuck, usually kind of get what you paid for. So I would just be careful with that. Okay. Any cost that you're going to get from any plastic surgeon includes a facility fee, which is the equipment. They have to pay the anesthesiologist and their OR staff for the time, and then the surgeon's fee, which you're paying the surgeon. That makes sense. So these are some photos. This lady, she lost a little bit of weight on her own. I think about 30, 40 pounds. She had liposuction with someone else, somewhere else, and didn't like her belly. She's got a lot of lumps and bumps here, still some saggy skin. So she also had implants I took out. I redid her liposuction. She has a lot of bruising, and redid her tummy tuck. So here she's very flat. The scar is straight. Pretty much it for her. This girl, she did lose some weight, so she had sleeve done in Mexico. She also had abdominoplasty done in Mexico. But then she had this huge like fluid collection, like we talked about, seroma, that just no one ever drained. They sent her back home. So I got an ultrasound, some imaging, tried to drain it, but the capsule was too thick. So I took her back, redid her tummy tuck, took out that capsuled seroma, and redid some liposuction. So this is her flat. She looks great. And then that's where she had a drain tube come out. And she's only 2 weeks in this picture, so she still has a lot of swelling that'll go down. So the risk, the same as a paniculectomy, but you'll have a little bit more pain because we're closing the ab muscles. And usually I give you some numbing medication for that. You have a higher chance of complications than a paniculectomy, just because we're pulling the skin very, very tight. Not too tight though, because then you can have a lot of issues. But usually the same kind of risk, if you will. This is something that I do want to talk about. So, does anyone know what visceral fat is? No. Yeah, so it's fat around the organs. So that no one can really get rid of except you, with healthy eating, low carbs, and exercise. We can remove any fat outside of your abdominal wall, which is here. But as you can see in this example, a lot of his roundness here comes from the yellow fat inside. We can't really do anything about that. So if you have that kind of hard, kind of like basketball-y look to your belly, usually, even if your BMI is like 29, you probably just want to change your diet, because if you have any of these plastic surgery procedures, you're still going to have that basketball kind of look, which is what I was talking about in that video with the lady. She still had a kind of full belly, even though we pulled her muscles together. That can only do so much. Okay. Fleur-de-lis. So this abdominoplasty just incorporates everything a regular or standard abdominoplasty does, except it removes tissue vertically and horizontally. So this way and this way, okay? The requirements are all the same. These are not my photos, but I did one week ago. I didn't have any pictures of her, but happy to send follow-ups. So this lady here, I think she had kids or something. So anyway, you see her scars straight up and down above the belly button and across here. Same thing with this lady, straight up and down across. And the reason why we do that is if we just pulled it down, you'd still have like skin looseness. Okay, so when you lose a lot of weight, usually a paniculectomy is not enough to give you the look that you want. Sometimes an abdominoplasty is not enough, and you have to do this. Okay, and the cost of that is around $11,000. I just put these up there because I didn't even know how much things cost until I finished training. So people don't really talk about cost, which is crazy to me. Any questions about that?
Does that go around your hips too, or is it
No.
just in the front?
We're going to talk about that. It's just in the front. But there is a procedure that's coming up next. So the fleur-de-lis abdominoplasty risks pretty much the same. As you can imagine, more risk of complications because we're creating more scars. Okay? Creating more space. Sounds good? So what you're talking about is a lower body lift or circumferential body lift, which is an abdominoplasty plus removing skin from the back, your sides. So you'll have a circular circumferential scar, okay, around here. Or belt lipectomy, that's another term for it. Same kind of requirements. We would repair the ab muscles, okay? Insurance does not approve this. And it helps raise your butt skin and your lateral thigh skin, okay? So a lot of times you lose weight, your skin sags back here and in the front. So that helps to lift the outer thighs and your butt, okay?
Sure.
Yes, okay. I can look at these all day. Okay. Hopefully no one's falling asleep. But that's, you know, this patient there. Any questions so far? No. So this is, right here is the, like, the butt fold or the crack, for lack of a better term. And this blue line is what he's gonna cut out. These red lines are just to help him keep the skin, when you close it, together, so you're not like walking, okay? And then he'll flip the patient over and do the same thing. For the tummy tuck.
Oh, it's LMC's computer.
Okay. So again, she's got a lot of folds, kind of saggy skin here, saggy skin here, and as you can see, these are the markings. You probably did some liposuction here. You don't really cut that skin out, but she also had a fleur-de-lis, so that up and down incision in here. So that's a scar there. The butt's lifted a little bit, and so are the thighs. Okay. An upper body lift can be done. So this does not address any abdominal tissue or anything, but if you have that roll that's like hanging over your bra or kind of looks like little wings, that's what this surgery would address. Okay? It's like here, she's got this roll, she's got that. And so essentially, we just cut all of this out and you have a scar that would ideally be in the bra line. Usually this is a little higher so that you can hide it with a bra. Okay? So arms and legs. Any questions about the trunk? So a lot of patients say that, well, my insurance covers a brachioplasty or a thighplasty. They don't. They'll have the terminology in their policy. They don't. They'll call the receptionist or whoever says, oh yeah, check your policy, yeah, we fine. They don't. Okay. And it's not that anybody's like trying to take your money. They're just trying to save you the hassle of submitting and waiting and being hopeful. Okay. So a brachioplasty is an arm lift where you're removing skin from the upper arm, skin and fat here. Reshapes the arms, improves contour. The BMI 30, usually that's relative. Okay, but you still have to wait if you're undergoing surgery this timeline. This one I actually want to show. What it looks like.
I have a quick question.
Yeah.
So as we're losing weight, and you have to wait obviously to get the surgery done. What about compression garments while you're losing weight?
Yeah, so that's a really good question.
Okay.
For the belly, I think it really helps with toning the abdominal muscle. But of course, still diet, exercise. But yeah, like a waist trainer.
I got
help.
one for upper body, for my arms and
Yeah.
breast area, also from the trunk. And I have to say I see.
You see some results.
I do.
And you know, if you feel like it's helping, great.
Yeah, I mean, anything could,
Anything can help. Do you sweat a lot in it?
You know when I usually do it, I usually come home from being out.
Yeah.
Like I'll go home and I'll put it on when I go home and then I'll leave it on
All day.
until I take a shower in the morning. So I find that, you get
Yeah.
a little sweaty.
And that's probably what's doing it. You're sweating,
Right, yeah, it's a little different.
burning a little bit of fat cells.
Yeah.
It's not gonna get rid of like,
No, I'm not trying to get
anything,
rid
but
of it.
yes.
I'm just trying to avoid,
Any issues?
full body
Yeah.
dysmorphia type of,
Anything that you see like online that other people are doing that seemingly helps, it's fine. But I just wouldn't go crazy or spend like a ton of money.
No, I just got simple things from Amazon that
Sure.
can also help,
It's not gonna hurt.
give a little support,
Big thing.
like from
Yep.
the skin, just keeping it up
Yep,
and
that
back,
helps. Yep.
That's what I ask.
Yeah, sure. I don't think it's gonna hurt anything.
Right.
Okay. Let's do this one. Almost done. Promise. So, okay. Yep. So that, yes, that's how that's the safest way to do it actually. So what you do is here. Yep, and I'll show.
on the top.
Nope, not on the top. It's under here. What you do is you liposuction first. Okay, so you have to do that to loosen up that skin. It decreases blood loss. Okay, and then once you do the liposuction, you really just pull the skin, because if you try to, cut through without doing the liposuction first, you cause more bleeding. You cause a risk to a special nerve that's here that causes sensation to your lower arm. Okay, so it looks really gruesome. Luckily, you're asleep during the surgery, but it is not meant to be like, barbaric. It's just, this is actually a new way to do it, and it is safer for you. Okay? That's the scar. So it's right here at the bottom. Okay? There she is there. It's very early after surgery. Scar is still very fresh. This is her some time later. The scar gets thin, and she's fine. Okay. So this is her after. Okay.
And you said this is the one that's not covered by insurance?
Not covered.
And how much does that one cost?
So around that, give or take. Because we're doing two sides. Again, improves the contour pretty well. The risk, like we talked about, so sometimes the scar can widen because the skin in that area is so thin. Same thing with the thighs. So we try not to pull too tight. The tighter you pull, the greater chance of your scar widening. Okay? You can have contour deformities if you liposuction to, not the right way. If you do it too tight, you can cause like constriction banding where you're basically cutting off your circulation. So we obviously try not to do that. Bleeding infection is another one, and then damage to that nerve that I mentioned. Okay. Thighplasty is essentially the same thing as an arm lift or brachioplasty, but it's for the thighs. There's a few different ways to do a thighplasty. You can have a scar straight up and down the thigh and the inside. You can have a scar around the groin, back to the buttock, or you can have both. It just depends on how much skin you have. Okay? And that's the cost there. So this woman had that straight up and down scar here. She lost some weight, has all this little skin wrinkling. Same thing here, up and down scar. This patient was a weight loss patient. And she had a thigh lift. Okay, so it does help improve significantly. Risks, same thing, but with a thighplasty specifically, if you get too close to the lymph nodes in the groin or the veins, that can cause swelling in your leg for a prolonged period of time. Okay, so usually we're just removing that superficial layer of skin. In fact, don't need to go any deeper or you'll cause this. Okay. Yeah.
Just wait for this one.
Okay. So with breasts, you have a breast reduction that applies to men and women. Removing extra skin and fat from the breast. Okay, that improves back pain, neck pain, bra strap grooving, shoulder pain. Okay, the BMI cutoff is a little higher for this. You don't need to have visceral obesity gone or anything because we're talking about breasts. Specific to breast reductions, though, you need to have a mammogram, a recent mammogram within a year if you're over 40. Okay, so I'll order one for you if you don't have one. Insurance typically covers a breast reduction, and they really just want you to have documented rashes like the paniculectomy. They want to see that you try to treat your back pain with like over-the-counter medications, physical therapy, chiropractic therapy for at least 3 months. Okay, and documentation of that, and or if you're planning to remove at least 1,000 grams from each breast. Okay. Some people add liposuction to breast reductions to remove what's underneath the arms, but usually that's an additional cost and it's not approved by insurance. Okay. If you have access to your charts, you may see a chart similar to this in there. It's called the Schnur scale. What we do is we calculate your body surface area because insurance wants us to, and then that translates into how many grams per breast we should remove. But usually insurances want me to say I will have to remove at least 500 grams per breast, which is like less than like a pound. Okay.
I'm so sorry. Does this have anything to do with the date that you had your surgery done?
Yeah, so still the same thing, yes, 18
Yeah, only
months.
18 months.
Yes, yeah, stable weight, yeah.
And can you do the breast and the stomach at the same time?
Yes, you can do the breast and the belly at the same time. If you want. Okay, I usually do 2 procedures max at the same time. So this lady is very large, saggy breasts. She's 3 months out after surgery. She was actually a smoker. I told her to stop smoking 6 weeks before and 6 weeks after, but she started smoking after. You can't really see it on this picture, but she had a very large wound here and confessed to smoking. So that's why you shouldn't smoke during, before, or after any kind of plastic surgery, okay? Because you want to look nice. You don't want big wounds or scars, anything. This girl lost some weight on her own. Her breasts became very droopy because of it, which happens when you lose weight. And she's 3.5 months from surgery. Usually when you're fairer skinned, it takes a lot longer for your scars, the color, to kind of go away. Usually it takes about a year. This girl, same thing. You have a lot of swelling, so I put this here to show. You have a lot of swelling up to 3 months after surgery from a breast reduction. So she looks fairly big here still, but then her breast, the swelling goes down, things settle down, and she's a little bit smaller here. The wrist, same thing, bleeding, infection, wound healing issues. Sometimes you'll have, scars that you don't like. We can always revise that. Nipple wound healing issues similar to the belly button. Decreased nipple sensation. Usually, though, sometimes patients say that it gets better, like more sensation after the surgery. Okay. A breast lift is a reduction, but on a smaller scale. But insurance may or may not cover it for after weight loss surgery. Yeah, it just depends. I don't know the rhyme or reason. I just submit it and then see if they cover it. But usually, if you lost a lot of weight and your breasts are very flat and deflated, you'll need or want more volume. And to do that, you'll need an implant or fat grafting, where we add fat from your own body to the breasts. Okay? And this really only lifts the breast, lifts the nipple, doesn't really add any volume if that's what your breasts look like after you lose a lot of weight. Okay? This person had a lift. She did not have a breast reduction per the grams removed, but this is her 3 months after surgery. Same thing here. This one, her breasts still were kind of full after she lost some weight, but again, the swelling does go down. She still wanted to be very full, so this is a lift, not a reduction.
Where's the incision? Underneath your breast?
Yeah, so you have an anchor type incision, so around the nipple, because we move it similar to the belly button, straight down and then underneath the breast here. But you can't really see that one. And this one fades pretty good.
I just said the insurance will sometimes cover it
Sometimes
if you
cover it.
have the
If you have
Rashing
a rashes,
issues.
yep, and if you've had weight loss surgery. Yep. Or loss of weight. So what to expect after really any of these surgeries, recovery-wise. So you'll have drain tubes, so you'll have little tubes from either your breast or your belly that drain just kind of blood-tinged fluid. Again, that fluid that your body likes to put in the space that was created. You'll have left dressings on. gauze or compression wrap that you'll wear for 4 to 12 weeks, depending on what surgery you've had. You can't really shower with the drain tubes just because that can introduce infection or bacteria. But you can sponge bath. Restricted activity for 4 to 8 weeks, depending on what surgery you had. Usually longer for the belly and the body contouring ones than breast. No smoking, but if you do smoke, you stop 2 months before and after, or until all of your wounds are completely healed. And I do tests at 2 months before we're thinking about a date, and then 1 week before surgery. And if your nicotine level's still high, then I'll just move the date. Okay. You should stop taking any Motrin, which if you've had any of these gastric surgeries, you probably shouldn't be taking Motrin. Fish oil or oral vitamin E, because those can cause bleeding. Well, I'll get some lab work, and if you have heart issues, we get clear for that. And like I said, no surgery if you have any kind of rheumatologic diseases. Okay, so reaching out to have any of these surgeries is completely normal. Document everything, including the rashes, with your primary care doctor or your surgeon. Anybody can have any of these procedures outside of having weight loss surgery, as long as you meet the criteria. If you're gonna have multiple things done, usually they're spaced out 3 months apart, okay? Say you wanna have your breast done, then we'll wait 3 months to do like the body lift, okay? If you don't want them done at the same time. And definitely adhering to any preoperative and postoperative recommendations is very important to prevent any sort of risks with these surgeries, okay? Any questions?
So, I have a question. So for all of these procedures, it's like you don't stay overnight, you just go.
Yep.
So what if you're doing 2 at once, same thing?
Same thing. We call and check on you the next day. I see you in 1 week. Usually, I promise, it's not the same as having your gastric sleeve or gastric bypass, because we're not really worried about any life-threatening things where you need to be watched. Really, it's just pain control and getting up and walking around.
What do you know about like the pain situation with those?
What do you mean?
Like how is it?
Really painful?
Yeah.
So we give you numbing, so I block usually any area that I'm gonna operate on. I give you all pain meds, muscle relaxers, nerve pain medications, plus Tylenol. So usually all of those patients do fairly well, and I don't have to refill any, pain medication. So usually after about 3 to 4 days, you're not taking the narcotic pain medication. You'll be sore, but you're not in like excruciating pain. If you are, then something is wrong, and you should call or go to the ER.
And one more thing, the fluid, the little pouches, like how do you maintain those?
Yep. So you will get instructions on that in the recovery, you and whoever you bring with you to surgery. The only thing you do is you empty the pouches every day and then close it back and record the output. Usually that's all you have to do.
For how long?
Until they come out, which is usually 2 weeks, give or take. For the breast, 1 week. And sometimes I don't even put them in the breast.
Okay.
And you said you do a nerve block. Is that something that you do prior to surgery or during surgery?
During surgery.
Okay.
While you're asleep.
A friend of mine had done in California, and she had a nerve block of some sort done before,
Yeah.
and then
We do it that way for the breast, usually, if you're doing like breast augmentation. But usually with the belly, I do it at the end, around the muscles, when I'm tightening the muscles for, say, a tummy tuck, and then your excision.
she said if I did, she had a success in the
Yes.
nerve block.
Yes, it helps tremendously. Any other questions?
Do
Is there an age limit?
No. Well, I mean, if you're like over 80, I'd say maybe just live your life. Unless it's like functional. But I've done surgeries on people over 70 that need it done. If they're like a young 70, you know, healthy, can take care of themselves, have adequate help at home, that kind of thing.
So we just need to call and set up a appointment with you to get, see what we.
Yeah. So if you scan this QR code, that'll take you to the website, Lexington Medical. Our office number is here.
Do you need a referral to see you?
So
You want me to chime in? I'll chime in on this one. So we actually built a pathway for Dr. Scott because, so she's a surgeon, right? So you want, when you get to her, you want to be able to have surgery, right?
Yeah.
Kind of like bariatrics, we have a process to get you there, right? So if you are considering something that's covered by insurance, so if you're considering like a peniculectomy, something like that, so we have a pathway in which you do that. So if you're 18 months out and you've been at a stable weight, or you want to get to a stable weight, or you're at there, so we would set you up with a nurse practitioner. The nurse practitioner would see you for those 3 visits, document everything, and then set you up for Dr. Scott from there. So anybody can do that. But yeah, I mean, it's just reaching out. Reach out to your nurse. That's the best thing to do. Reach out to whoever your nurse is, and they'll look at kind of where you're at. You meet BMI qualifications, things like that. But we'll work you through the system with the nurse practitioner to set you up to see her. Anything else like self-pay options, you could go straight to her. So anything that insurance wouldn't cover can go to her as long as you would qualify. Obviously. So, yeah.
You have a question and then you can think. Yep.
So I actually had two. The first one being with the peniculectomy. You said it was if you had rashes or if you just had extreme weight loss. Like, is that or?
Both. The peniculectomy, the rashes, back pain, and it is or, but even if with the or, they still want you to have rashes
Okay.
documented. Does that make sense?
Yes. And then the next question was with like the hospital specific like insurance. You know, do you know more about that coverage because it is the hospital or?
So that's Blue Cross, right?
Blue Cross Blue.
Yeah.
Yeah, but then there's like subsets of Blue Cross.
Mm-hmm.
Some of them just absolutely do not cover certain things, and it's like a fine print.
So
Some
just
of them
better
will
ask.
say this person has to be within 20% of their ideal body weight, which is ridiculous. Even for breasts. We don't really know that until we submit it, and then they send the denial letter, and that is the reason.
Okay.
But Blue Cross Blue Shield is like probably the hardest for breasts. Yeah.
That depends on which Blue Cross Blue Shield.
Yes, and it depends on which one.
And every medical policy with each Blue Cross Blue Shield is gonna be different.
Yeah.
So whoever
Yeah.
your policy goes through, check their website. That information is out there for
Yeah.
you to see.
Yeah.
It'll show the medical requirements, what they ask for, and then check your policy, because even if it's covered under medically necessary, if your policy's not gonna cover it, it doesn't matter if it's medically necessary.
Yeah.
It's not gonna be paid for. Sorry, I work for insurance.
And there are some, so state covers it. State covers our peniculectomy typically, but they don't cover bariatric surgery.
Yeah.
So there are some that have that option too. So we'll do that work for you.
I had an issue with mine, because they said something about having the bariatric surgery done, and they did it to my secondary, which was Medicare, because I have Blue Cross Blue Shield, I have Blue Cross Blue Shield Ohio, which is different than in-state, and they actually have to rebill.
Yeah, that'll happen.
Because they didn't bill, and then Medicare was.
They won't pay it if they don't
Medicare was
bill
like,
and say it's
yeah.
surgery. Yeah.
So I had a back and forth with them, but,
Little claims issues.
yeah, it was just.
We'll take care of that research.
I have two questions. One is, okay, so with the insurance, so for instance, I want the abdominoplasty, but, the insurance approves me for the peniculectomy. Can I get the abdominoplasty and pay the difference?
So if you that's a little tricky.
It's a good question.
I don't make the rules. I just work here. Yeah, sometimes I'll like do something. I'll do, yeah. So, you just have to-
And my second question is, because I saw that one of the things that you don't like it, it's as a person is like a high clotting patient.
Mhm.
Okay, so I'm a high clotting patient.
Okay.
Blood clotting disorder. And I take medication for every day. So does that mean I could never have it?
No. I'm just very strict. And sometimes you can give patients blood thinners after surgery. That's one of the recommendations.
I mean, I'm on blood thinners for life, so.
Yeah, but because you're on blood thinners and doing an elective surgery, because none of this you have to have done. I usually say risk benefit. I would probably refer you to someone else, but that's just me.
I mean, even to get my bariatric surgery, I had to get it.
Yes. So yeah. Yeah. That I'm very strict. Just because I think safety over this. I mean, this is great. I love what I do, but I mean, if you get a pulmonary embolism, a blood clot in your lungs, then that's like a whole thing.
It's the purpose of the benefit.
Yeah. Yeah.
The prices you had up there, is that before insurance or after?
That is, those are cosmetic procedures that we're not submitting to insurance. So I'm just out of pocket.
And can we get access to your slide, or do you put that on the site, or?
I don't know, because there's patient photos that like on my.
Well, besides the videos, I don't want that. Like all the other information.
I can take the photos out.
I was gonna say,
Yeah.
I can put together like a little information
Yeah.
sheet
Yeah.
too,
Yeah.
just from those and just go over them with her, and I can put that up.
Yep.
Sorry. I missed the very beginning where you were talking about like the ideal body weight
Mhm.
versus like the actual. How did you calculate that again?
Yeah. Okay. This, we adjusted?
Mm-hmm.
Yep, so, okay, well, let's go back. So, this is the ideal body weight calculation. Let me take a picture of it.
And if you need to convert pounds to kilograms, it's 2.2. So divided by 2.2, it'll get you.
You can also find
then-
some calculators on Google that do that.
Yeah.
Yeah.
And then the adjusted body weight was this.
And you go off of the adjusted, or
Well,
Yeah. Jenny.
well, I was pointing the laser at you, sorry. What do you guys use? Do you really use the adjusted body weight when you're talking about like excess weight, how much weight?
We kind of go from a BMI of
BMI.
25, you know,
Okay.
versus, we definitely don't use ideal body weight because those
Yeah.
were made in the 50s, you know, by insurance companies, by the way.
Yeah.
But yeah, we go, you know, amount of weight over a BMI of 25.
I know some dietitians use this.
We used to use it a lot in the past.
Yeah.
so basically we're really just shooting for that BMI of 30 or under.
30 for the cosmetic procedures. Definitely under 37, 35 for ankylectomies, breast reduction, and that thing. And, yeah. I was gonna say something else, but any other questions?
So when
when you do the arms, you do both of them at the same time, or the thighs at the same time?
Yep, 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 both arms at the same time, both thighs, yeah.
You can still move and do stuff.
Well, you can
Continue, probably.
move, but no strenuous activity, no, like you probably won't want to move that area. But you'll be sore for a little bit. It looks like a lot, but I promise it's not. After about a week and a half, 2 weeks, you'll feel much better.
Yes, it looks like a lot, that's why we go to sleep.
Yes. And you don't want, and being in the hospital, one is you're exposed to patients who have real illnesses and infections. You're having an elective surgery, and ideally you're healthy. You don't want to be around those people. So even like surgeries where we kept people in the hospital for 4 or 5 days, they're going home 1 day after surgery. So we're moving away from keeping in the hospital. You don't need to be in the hospital. Yeah.
Like working out wise, how long do you have to go before like you can start doing like walking, like I guess on the treadmill or whatever, and then moving on to like weights and more strenuous stuff?
Sure. So for walking, let's say you got a tummy tuck or a paniculectomy. Usually, I want you to walk like around the house, like day one.
Yeah.
But for walking exercise-wise and low-impact things, about 4 weeks. Okay, so nothing that's going to cause you to like bounce or use your core muscles too much. For the breast, usually 4 weeks for lifting, doing that kind of thing, push-ups, yoga.
But like weightlifting, how long are you gonna be out before you can start like lifting?
For belly,
Heavy,
6
yeah.
weeks, depending
Okay.
on how you're doing, your pain level, healing. And just be kind of smart about it. Listen to your body after any of these surgeries. The 6 weeks is like my rule, but if your body's saying, hey, like, you can't lift 20 pounds yet, don't overdo it. Just start light after that and go up. So if you're like gung-ho, like I work out really hard, think about when you want to have the surgery. If you want to have it, because you will be down. Okay, you can't go back to working out 2 weeks after surgery.
Anything else? Awesome. Well, thank you so much.
Yes, thank you.
Appreciate y'all coming.
Okay, yeah, we'll try to figure out kind of.
I'll get with Dr. Scott and put some, like kind of an informational sheet for you guys. And if you all follow us on Facebook and Instagram, I'll put something out there on there so that you all have that. And we'll have the recording for this too available on our website as well. So. You were recorded, you didn't even know, did you? Yeah.
The next month is exercise, and we're gonna have somebody come and do exercise from health directions, so come comfortable. Yeah.
Okay. Thank you so much. Thank you all for coming. If you guys have any questions for us, let us know. Okay? Anyone that didn't sign in, please sign in on this too.
Sleeper got my bath. First one, I get that. I got what they were talking about here, where you get fluid built up over. I have looked at it real close when but I can see chills because I know I know. I come to find out I'm allergic to the glue from family. I have to, my normally, okay, I used to put like a gauze, like a good takeover. I come to find out the glue from family. I'm afraid